night before surgery. I'm a new patient for Dr. Brady. I knew that I was uncomfortable with myself, but I didn't really know if it was just normal, if it was something you just live with. So I had a couple of friends that had this procedure done, and I said, maybe that's something that I could get to do. I was so excited. They made it so normal. I didn't feel uncomfortable 1 second through this whole process. I haven't doubted that it's what I'm supposed to do. I haven't felt uncomfortable. I haven't felt like I was being selfish, which is what I was worried about. I was worried about feeling selfish because I have babies to take care of, and what am I doing driving around, having a surgery to make myself feel better? But I'm so excited, and I think it's just going to make me a better me and a better mommy and a better wife, and make me more confident in who I am finally. I went for my face-to-face consultation about a month ago. Had met Dr. Brady, had her actually explain to me that everything I was feeling and thinking was what she hears all day long. It wasn't anything abnormal, out of the ordinary, which I thought I was. You always feel like you're the only one. Well, they, in the first 5 minutes, had me for sure that I'm not the only one who was uncomfortable with my own body and who wanted to do something about it.
She had had 4 vaginal deliveries, 4 big boys, big babies, and all of those big heads and shoulders just pushed all the support tissue out to the side. She had bladder prolapse, which means when I was looking at the bladder and she was coughing, the bladder would fall down and fall out. She was having some leaking of urine with coughing and sneezing. That's called stress incontinence.
I have been assured that it's going to be okay, that reading the testimonials and reading the surveys that are in the survey book in the office, that this is going to just be a kind of a life-changing experience, and I'm not just mommy anymore. That I get to be a woman and feel good about myself for the first time in a long time. I was scheduled for 7:30 and I got back about 7:40. Got out about 10:30ish, I think. I looked at the clock, and then through recovery and through the step down, I think they called it, and then out of there. Went out in a wheelchair, wasn't any big deal. Got right in the car and got back here to the hotel about 2-ish. I got several doses of pain medicine, and then went to the step down and got some more, and then some IV pain medicine, and then also a tramadol pill, crackers, water, and definitely got it under control. About 30 minutes before I left, they gave me IV Toradol, which is good stuff. Wouldn't make me any more sleepy, and man, that helped a lot. And I left really, honestly, pain level was maybe a 2 or 3, and it's not even pain. The pain it's more of a muscle soreness, like you worked out, your muscles are sore. It's like a soreness. It's not sharp, it's not stabbing, it's not unbearable, it's not doubled over. It's just really just kind of a deep soreness.
The first procedure she had is called an anterior repair, and that's a procedure where I place the bladder back inside the vagina up top where it belongs. The second procedure she had is called vaginal rejuvenation or vaginoplasty, which is a surgical procedure to tighten the vagina. The surgeries themselves both together took about 2 hours to perform. And after surgery, she did very well as far as leaking of urine had mostly completely resolved, and certainly the prolapse was completely fixed. And she also wanted to be as tight as she was from a vaginal standpoint after she lost her virginity, before she had her first vaginal delivery, which we certainly achieved. So she was nice and tight from a muscle tone standpoint.
No real side effects, no real complications. I don't have a bad thing. I think I'm more scared of the pain getting worse than it really is. Honestly, I haven't had a time, except right post-op, it was getting kind of real, but they got it down in just a couple minutes, less than 5 minutes. I was to a tolerable number. Getting my appetite back, pain is fine, no nausea, still no burning, no stinging, no itching, no swelling. So I once again have nothing scary to tell you. Just a very, very pleasant experience so far. So get some food in my tummy, and I will talk to you tomorrow. Hello again. Today is Wednesday. This is post-op day 2. I did not record a video yesterday because I felt pretty yucky yesterday. I was, really hopeful that the video before the last video, that I would keep just continuing doing pretty well. But yesterday really was a rough day. I had a lot of pain. Nothing I really did made me very comfortable. I was taking my medicine every time I could. They called me from Dr. Brady's office to ask how I was doing, and she suggested that maybe I take the nausea medicine, the Phenergan that makes you sleepy, and I felt like I probably need to do that. If I could take a nap, maybe I could kind of get my feet under me again, because I was exhausted. I hadn't slept at all. And I was super tired. And then that made me emotional, and then that made the pain worse. So I finally did. I broke down yesterday afternoon, took one of the Phenergan, and I took about an hour and a half nap, and even just that hour and a half made me feel so much better. So I'm still taking all the meds today. This is, like I said, day 2 after surgery, and I'm still taking everything. I haven't really slowed down on anything yet. I tried to the day before and got myself in trouble. So today I'm not going to. I'm going to keep taking them. And I'm already having such a better day. I put on some clothes. I haven't taken a shower yet, but I am about to do that. Took out the packing yesterday. And I've known just from my own patients how much was in there, so I wasn't shocked at how much, but it was a lot. That was a little painful. Use your squirt bottle, get that wet. Squirt it down if it gets stuck, because it is a lot. It released some of the pressure, but not as much as I was kind of hoping it would. But today it feels a ton better. It does. It really does. I get the catheter out tomorrow, so I'll just keep hanging with it today. Today I started the bladder training, so you clamp it. You're supposed to do it for 4 hours and then let it out. But I have been drinking so much water, I can't make it 4 hours. I feel like I'm going to explode. I feel like I need to go to the bathroom really bad. I put on some clean clothes a while ago and went and put a blanket around me, hid my catheter, and walked around up and down the hall. And I could actually stand up straight. The last 2 days I couldn't stand up straight. Every time I tried to stand up straight, I just felt like everything was pulling and pushing and I couldn't do it. So today I'm standing up straight. I'm walking okay, a little waddling, but it doesn't hurt. It's more of a protective thing. I think that's about it. I'm just hoping I keep up the pain level I have today, because right now it's maybe a 3 or a 4, and that's walking around and moving around. So it's very definitely much better than yesterday. So that's about all I have to say. Talk to you later. Hi, it is December 21st now. I'm 2 weeks out. I'm going to try to get out of the house a little bit today. I haven't been out. I've been outside just to kind of walk around, but not really to really do a whole lot. I haven't really felt very up to it. Been taking ibuprofen, the pain meds, really just every 2 or 3 days I'll have to take a tramadol, and that pretty much kept it under control. If I try to be tough and go longer than that, it doesn't last very long. I need to take a pill, but only every 2, 3, maybe 4 days. Ibuprofen has helped a lot. Pretty much just kept the ice packs constantly. That's helped more than anything, and I don't go anywhere without my donut pillow. That's been my lifesaver. Donut pillow, ibuprofen, and ice pack. Stool softeners, that's the number one key to feeling good right now. I hope that gets better by itself and I don't have to take those forever, but right now that's been the major problem, is just getting my tummy going again. I think the most challenging part about having the surgery was just being patient. And they warn you and they tell you, be patient. It's going to take a little while. You're not going to jump up the next day. But that was hard for me. That was hard for me to sit down and let it heal and let somebody else tell me what to do and trust them. That was the most challenging part. During my recovery, dealing with the kids was, I had kids at home. And I was off of work and had kids at home. It was a little bit difficult because they like to lay all over me and sit in my lap, and that was a little bit difficult. But just the same thing is when you have another baby, you can't pick them up, you can't carry, you can't clean too long, you can't stand and cook too long, and you just have to set boundaries. If you got through having a baby recovery, this is about along the same lines. It might be a little bit more and a little bit different, but along the same lines as having a baby. Dr. Brady and her team are above anybody I've ever worked with, been a part of. If I lived here, I would want to be a part of this team. They're so above standard. They're I don't know how they treat every patient like they do. I mean, I don't think I was treated any differently than anybody else, and I don't know how they could maintain that level of professionalism and caring and just comfort and warmness with every patient. I feel like this is the first thing I've done for myself in a long time, and I just feel, if that makes any sense, put together. I just feel like I'm back together, like I'm a whole person again, like I don't have anything to be ashamed of anymore. I can do what I want to do, work out when I want to work out, laugh when I want to laugh, and run when I want to run, and I feel confident, and I just feel whole again, and it changed how I feel about myself for the first time in a long time, and it was definitely worth that part.